If your portfolio hasn't been doing as hot as you wish it did, then can I just suggest that we actually start investing in a few things that are working right now, companies that are actually making money in this environment in growth markets. Hi, this is Fabi with Equity.Guru, and today I want to talk about a company that is very active in a service that you and I both use. I probably use it more than you do, and that is medical IT or health-related IT. It is a growth sector. These guys are no joke. They have a lot of experience. They've done it before, and they have just secured a contract with the Nova Scotia government. See, I told you they know what they're doing. Let's take a look. So VitalHub Inc. is a very interesting company because they are working on mental health and long-term care, also patient flow solutions, and their growth strategy is through M&A. I'm going to get into the nitty-gritty of the M&A really soon. But before we get into that, I'm sure you've been to a hospital where you found that maybe you were in there for too long or in there for not long enough, and it costs the hospital thousands of dollars to not have the proper amount of care for the right person at the right time. That's the sort of solution that VitalHub can bring because they have all the information for the patient and it's a management system for healthcare. Okay, so let's get into who is who. And I find that the less you know about a particular sector, the more you need to rely on the people that are running it, in the sense that they need to have a proven record. And a proven record is not just X amount of years in this sector, but also X amount of years with proper success. So you're looking for buyouts here. You're looking for them having done this job in a similar market before. You're basically looking for validation that these people can do it again, and doing it again is safer than just doing it for the first time. So here we have this name that's going to come up a lot, MedWorks. Now MedWorks is a company, as you'll see here, three of these guys are from MedWorks, and apparently they all have almost 20 to 30 years of experience in health IT. Okay, so this is very specific. It's not just IT, it's not just health, but in health IT. Thumbs up for me. Now let's take a look at MedWorks really quickly. Like I just said, healthcare IT company. They were traded on the TSX, and what happened to them? Well, they got sold for $20 million to Aptian. This happened in 2015. And if you're wondering what kind of return it had, the share price went from 5 cents to 60 cents. Not bad, not bad. They did get up to 8 million in revenue across 5 countries, and they have already surpassed that in 2018. So this is looking good. You want the second shot to be stronger than the first one as well. And it kind of brings the question, why would these guys who sold a company in the same sector actually come back to it? And in my mind, the only reason why you would try to work within the same sector and do a company from scratch is while you were operating in the first company, you probably saw more opportunity within that sector. And that's what you're trying to go after. Nobody, builds a nice little company and then builds a second company aiming to go smaller than the first. So these guys have already surpassed that. So these are the acquisitions that they have, and you can go through these and take a look at what they have been able to do so far. These are 5 names, but let's take a look at what the requirements are for them to buy them in the first place. So this is what they do. They already have 15 companies that they're looking at in Canada, UK, Australia. The annual revenues of each company is, anywhere from 1 to 7 million. They buy them out with a combination of cash and stock. Their aim is to reduce costs by 20% with the synergies that they have with the companies that they already own and operate. Their target is 20% to 30% EBITDA by cross-selling and reducing those costs. So basically, if you own company 1, 2, 3, 4, 5, I'm sure that if company 5 has a really cool product, you can make the other 4 sell that product as an add-on, as an upsell as well. And they purchase these companies anywhere from 1 to 2.5 times their revenue. Now they're able to keep their costs down because they have a development team that's in Sri Lanka. So they're able to pay less for the development of their IT product. I like this, good move. Management controls almost 50% of the company, so you want to see that. You want to see lots and lots of skin in the game. Now, if you go on the website, you're going to see that the listed revenues is just for 9 months. This is incomplete. Let's take a look at 2018 as a whole. So in 2018, they had an income of 9 million, just over 9 million, $9.1 million. In 2017, as a comparison, you have 1.14, almost 1.5 million. So in a company like this that sells a real service with real clients that are paying today, this is what you want to see. You want to see huge revenue growth. Sometimes you're not going to see profits straight away, but you will see that the company is getting healthier and healthier and the top line is fattening. So the loss from operations in 2017 was just over $2.3 million. And in 2018, it was a mere $520,000. This is huge. This means that you see an improvement in both the top line and the bottom line. And bear in mind, these guys work with recurring revenue. So you purchase a company like they have today, and that's going to generate revenue for many, many years to come. I like that too. Something else I like to see is the new strategic investor they have in Astra. That was financed at 16 cents. And it's great when other people in the sector are putting their money into this company. It's also nice to see that the financing was done at 16 cents, which is very close to today's market price of 18 cents. Knowing that they did $9 million in sales last year, it seems to me that it's not going to stick within this range from, 16, 17 to 21 for very long. Now, this is a real sustainable business. They have real growth in many different ways. These guys know what they're doing. I see a lot of potential here. Oh, and by the way, VitalHub uses blockchain for some of its products. And this is what we really need to understand about blockchain. It needs to be used in some industries, such as healthcare, such as the organization of information, having information available to you consistently and quickly in the palm of your hands with your mobile service. This is a real use case of blockchain, but it's being monetized in the real world and making real money. This is VitalHub.